Well, good afternoon or late afternoon, I'm going to say. My name is Kathlene Camp, and I'm from the University of North Texas Health Science Center at Fort Worth. Yes, we've undergone some name changes, so our title just gets longer. But I'm glad that you can join us today, or maybe that you've had a chance to join us later with this recording. I want to thank again. Fit Worth and with your as long with your organizations for inviting me to speak today about health and wellness and physical fitness. So this is something that we all need right now, or we're being challenged right now. I think with having regular access to where we normally maybe engage in some exercise or activity. So hopefully I can give you some insight into how we can still during this pandemic work it into our lifestyle and into our routine. So again, as I mentioned, my name is Kathlene Camp, and I'm a physical therapist and assistant professor here at the University of North Texas Health Science Center, and I work in the Department of Geriatrics. So even though I work with the older clientele, I've had a history of working with younger with our youth as well. I was an athletic trainer, and then I went on to get my physical therapy degree and have worked in areas of hospital, acute care, rehabilitation, outpatient, and now I work primarily again in an outpatient setting and both in the clinic and the home, but primarily see an older clientele. So you'll kind of get a feel and a theme from this and some of my initial slides, because that's usually who my audience is those that are either of an older population or work with older adults. But we're all going to get there someday, I hope. But, I think the major theme here is that exercise is medicine, regardless of what your age is. I've always loved this quote from Dr. Robert Butler: if exercise could be packaged into a pill, it would be the single most widely prescribed and beneficial medicine in the nation. Taking a pill is easy. Exercise isn't as easy. But maybe again, I'll convince you today that it should be something that we should consider to be taking daily, and consider it to be as important as taking some of those prescriptions. And hopefully, you're not having to take a lot, but just think of it as one of the best vitamins that you can take. But Dr. Butler was very proactive and engaging, especially in the area of geriatrics and gerontology. He was actually the founding director of the National Institute of Aging with the National Institute of Health. He was also the founder of the first department of geriatrics. And so that is a specialty, especially now in medicine. And I think they help address some very important aspects as we grow older. But he was, shared a lot of his wisdom and his pearls. Also, as an author, he, started the longevity revolution in 2008 and gave some details to this with his prescription. So his books are out there. I think they're very, helpful for us even before we reach that age. But he, also said that, it was really discriminatory to talk about older adults in the term of, ageism. And so, again, I think we need to be respectful that, we're all going to age, and really what are the expectations of aging? It shouldn't be all with decline. And so exercise plays an important role in making sure that we do this in a successful way. Another book I really enjoyed reading a few years back was by Dr. Roger Landry, that really gave pearls of wisdom that I think are applicable even now before we reach, later age. And it said, whether you're in early adulthood or, especially as establishing a career as maybe an educator, or middle adulthood, maybe where you're balancing those roles, maybe in teaching and family and work life, or maybe even more towards mature adulthood, where we have opportunities to be more mentors or be involved with volunteerism. He was basically saying that an active lifestyle through all of these very integral ages were very important in supporting our health and well-being. And so I encourage you, if you'd like to pick up this book. I think that a lot of the major themes that come out of it is how important it is to keep moving, to use it or lose it. And he addresses that importance of, again, exercise for challenging our brain. But he also talks about other aspects of, staying connected, never acting your age. That's something important for educators. And he also talked about the value and importance of actually having children in your life throughout your life. So there you go. You've got lots of children around you. So that should be good. And that we should constantly be challenging ourselves, both physically as well as cognitively. And I keep trying to remind myself that as well when I continually try and advance my own education. But again, it's to help us again live a successful life as we age. So some of the other efforts that you may have heard, throughout some other efforts in trying to encourage, where are we going with how we control how well we age, that activity is the key. And that comes out whether you're talking about, some of the information that came from Dr. Landry and but also in the blue zones, you've probably heard of that. That's been promoted quite a bit. And what you see there listing is they also talk about the importance of family and lifestyle habits with smoking or eating. But notice there that constant moderate activity, that was a key factor of the blue zones recommendations as well. And then there you go, the social engagement and then managing our stress. These were also, again, some points that were brought up in the MacArthur characteristics for successful aging that talked again about the importance of physical and mental activity, social connection, having a purpose, and really controlling risk factors. So unfortunately, some of the information that comes down when we have our census and asking about activity levels in adults is we see that only about 25% of older adults actually get the recommended amount of physical activity. And unfortunately, we actually see that even fewer, 20% of high school students actually fully meet the physical activity guidelines that are recommended. And so that's a concern as we move forward, especially because we know that sort of eating habits, exercise habits, things like that start early. And so that's a concern again, what is happening that maybe is not promoting physical activity for even our youth. So in 2018, the physical activity guidelines was sort of updated again from the CDC, and that information is widely available for consumers and for the community. And I encourage you. I've got links in this presentation, but they have guidelines for all age groups. And I think again, thinking about how this applies, but some of the major components of exercise that they talk about that we all heard about that are important is getting some aerobic activity in. And aerobic activity is anything that, gets that heart rate up, gets you breathing a little bit harder. And so examples of that would be, again, brisk walking or running, swimming or cycling, anything like that, that again, moves us for a sustained period of time. And when we talk about, components of aerobic exercise, we talk about intensity. How hard are we working during that activity? We also maybe need to talk about frequency. How often during the week are you engaging in that? And then duration. So we'll talk about what the guidelines are recommending and how we measure these. But another component of activity is muscle strengthening. And so again, that's exercise that might engage us, again, building up strength, whether it's through lifting weights or using resistance bands, but it can also, be body weight exercise. But even activity, again, the things that we need to do on the weekend to clean house or work in the garden, do work, that's also considered muscle strengthening exercise. For the same components, we also want to kind of touch a little bit about, well, how often do I need to do it? How intense does it need to be in order for me to get physical health gains? And then this is a recent passion of mine, is talking about bone strengthening exercises. This is, we often think about bone strength, especially when it comes from the standpoint of when bones fail, right? When we break a bone, or with, the population that I work with, when they have a fall and maybe even break a bone. And so, but bone strengthening needs to be, in our attention, even when we're younger, and especially maybe even when we're young, because that's the time period that we actually build up what we call bone mass. So we actually build up the strength of our bones, much in those first couple of decades of life. Um, but when we think about maintaining then that bone mass that we've built up, we need to continue to do activity that puts impact or tension on the bones, because it's a constant remodeling phase, even through adulthood. And unfortunately, into late adulthood, especially with postmenopausal women, or as hormones decline for both men and women, we do start to see more loss than we do see growth. And so our efforts at that point in time are trying to slow down the loss. And so we'll talk about that a little bit as well. But some of the examples of activities that help, especially early on in building up bone mass, are things that have more novel movement. Running is good, it is impact, but they're actually showing through current research that sometimes even have movement in different directions, maybe that you might get more with basketball or soccer, things of that nature might actually help promote more growth. But we'll talk again about later on when we maybe aren't engaged in those type of activities, actually strengthening exercises, lifting weights can also help promote bone strengthening. So I mentioned before about intensity, and oftentimes when we talk about intensity and in the research, it says we should be doing moderate to vigorous intensity activities. Well, what does that mean? We have these scales. If you were involved in a clinical research room and they were doing things, there's ways that they can measure intensity levels, but we also talk about it from a metabolic level, and that's when you see these METs. Obviously, the higher the number, the higher metabolic intensity of that activity. But we often also use what we call a PRE, or perceived rate of exertion scale. And this, you can see some different scales, but typically one scale would be as on a scale of 0 to 10, how hard do you feel like you're working? 0 would be not hard at all. You're actually probably sitting on the couch there, to a level of 5 or 6, which is, I'm working pretty hard or somewhat hard. And upwards on that scale, when you get to that 7 or 8 on the vigorous level, would be that, that's a level where you're almost getting a little bit breathless. So that's why they, often will say, well, instead of having this scale to look at, and instead of maybe measuring heart rate, you can get a target heart rate to measure intensity level. But one easy way is the talk test. And so as a rule of thumb, if you're working at that moderate intensity level, you should be able to talk to somebody, carry on a conversation, get about 5 to 7 words before you have to take a breath and keep on going. But you wouldn't be able to sing. If you were having more difficulty actually singing, then you're probably more at that vigorous intensity level, where maybe just getting a few words before you had to, take a breath would indicate that you're at that vigorous intensity. So they've shown good correlation between this talk test and actually measuring heart rate. But if you have a heart rate monitor and you can, calculate that, then that's valuable information as well to let you know if you're getting the right intensity from the aerobic activity that you're doing. So this is a long list, and I just want to show it to you because what's the payoff? That's always good news to know that there's a lot of benefits to physical activity. Now, even though this list is for adults and older adults, we see that there's benefit as well for younger adults that we'll talk about as well. That will help you as educators to encourage your students to be exercising. From this list here, there's been a lot of research behind to defend each of these. But this is good news to us. The items in bold are those that actually have been recently added from newer research. So, this should be good news to us. One, we can, manage some of the higher disease conditions like cardiovascular, heart disease, stroke, things of that sort, as well as, high blood pressure and diabetes. These are some of the top, health conditions that really age us faster than we'd like to, and often require medication intervention if we don't manage it through exercise. Um, but cancer, that's probably been a very exciting area to show that actually physical activity and exercise can be preventative of cancer. And if you're having to undergo cancer, it's actually been shown to improve the quality of life in cancer survivors. And oftentimes exercise is even used while people are going through cancer treatments. In my area, again, with older adults, there is quite a bit of concern about the rising numbers of decline in cognition with dementia, especially even Alzheimer's related dementia. And so cognitively, we find that there's benefits, again, to prevent the onset of dementia through exercise. And that improved cognition piece, that's for youth as well as older adults. So we know that it improves brain health. Exercise improves circulation, and we find that there are quite a few neurotransmitters and chemicals that are helping to improve and protect our brains. So a good reason right there that we should all be engaged. And as you can see over there on the right-hand side, anxiety, depression, we know that these are issues, especially right now, going on and arise with a lot of the stressors. So how can we combat some of this stress and issues with, social isolation? Well, physical activity and exercise is definitely key there. And we'll talk again about maybe some implementation of this to further address those issues. It definitely helps to promote good sleep. And so, even though they suggest sometimes maybe not a lot of exercise right before you go to bed, but just having a regular routine can definitely help with those sleep patterns. And it obviously, again, to help control with weight. That's often the reason, the motivating factor we all gauge in exercise. But besides just weight loss, I think, again, having some structured exercise or physical activity not only helps to reduce weight because of the metabolic benefit that you're getting, but also maybe because you're spending more time exercising and more time or less time near the refrigerator. And so again, as I mentioned before, especially strengthening exercises or impact exercise can help with bone health. And with our older adults, we really talk about the quality of life, physical function, lower risk of falls, and maybe even fall-related injuries, if we can actually get, again, more consistency with appropriate level of physical activity and exercise. So for our youth, yes, we should be encouraging them to be engaged in exercise. Again, because of that bone health, those developmental years are very important, that they're retaining or reaching that bone mass. We often talk about it and refer to it as a bone bank. Everything that they do to promote physical activity, exercise, movement, impact, they're investing into their future adult years. We want our youth also to, control their weight. We know that with more time behind the computer screens and engaged in, computer games and things like that into their phones, they're most likely going to be having to gain more weight. And that impacts, again, their self-image, their, again, health status as well, even at a young age. So anything that we can do to encourage youth early on is important. We know that this has been promoted, again, through the CDC. We'll talk about, again, the volume that they should be engaging in. And we're thankfully getting that awareness through other avenues and challenges as well through professional sports. But I highlighted on this screen, again, improved cognition. So if you're wanting your students to really retain the information that you're giving them, encourage them. They need to take some computer breaks, right? They need to step away from the desk. They need to step away from the computer. And especially if they're engaged in exercise a little bit after, attaining new knowledge, that actually helps to drive it in. And there's evidence to show that. And, unfortunately, we have to talk about depression even with our youth. So we know, again, engaging them in physical activity will help reduce this risk of depression. So what are the guidelines and what do they suggest? A lot didn't change with these updated guidelines other than adults should move more and sit less. They gave permission to say any little bit helps. And so we've all heard the Chinese proverb that, a journey of 1,000 miles begins with one step. And they did find that, yes, if that's the hardest step to take, sometimes it's getting initiated in exercise. So we really want to promote and support how to just get going. Um, and there's a Japanese method of what they call Kaizen. And Kaizen is that method of taking small steps to accomplish huge goals. And so sometimes exercise, especially for these guidelines that they're providing for us of about at least 150 minutes of, sort of moderate intensity to more, type vigorous intensity, that could be, you know, kind of intimidating. So we would need to just get people started, and sometimes getting them started will actually kind of help give them those small approachable steps to reaching the guidelines as suggested. So for adults, yes, they suggest 150 to 300 minutes a week of that moderate intensity level. So again, something that sort of gets you a little bit breathless, but again, that you aren't trying to sing. Or 75 minutes to 150 minutes of vigorous intensity. So, dividing that up throughout the week, thinking about when you can work that in. So any combination of moderate to vigorous intensity is going to really give us that the most health benefit. So just even starting out at the smaller, lower level is a start, right? And even less shorter levels, bouts of 10 minutes at a time, and building it in and finding about how you can maybe even increase that in the physical activities. So maybe again, parking a little further, not necessarily trying to find the closest spot, taking the stairs rather than taking an elevator, not shying away from that hill, trying to find opportunities where you can engage in more kind of activity that gets you again a little bit breathless. And then it also is recommended that we should be doing some muscle strengthening at least 2 or more days a week. So finding out a way, again, whether it's body weight resistance with push-ups, step ups, chair squats, things of that sort, or actually, picking up weights and doing resisted type training. And really targeting more major muscle groups. So if you could even just pick 5 to 7 exercises, upper and lower kind of body, maybe maybe you only have time on a couple of days of the week to do 10 minutes, and I'm going to do upper body, and on a couple other days of the week I'll focus on lower body. So you hear people talk about their leg day or their arm day, or working in a little trunk exercises. Now, for children, it's really important that they also be engaged in some similar aerobic and muscle strengthening exercises. The big campaign with children is the 60 minutes a day, kind of component. So maybe if they just break that up. So we're just talking about for 1 hour of the day, they should be engaged in moderate to vigorous activity. And I know when we've taken away some of the focus from PE and sports and things of that sort, we need to just be encouraging our kids to continue to find a way to implement some of that activity in. And as I mentioned before, the NFL was their Play 60 campaign. So just again, getting the message out there is important. And it should for kids. It doesn't have to be, if they're not involved in athletics in a sport team, it should be just fun. It should be, going to the park and things of that sort, making it engaging. And sometimes as parents, if any of that we can do alongside and model that to our kids is great. So I encourage you, again, as an educator, as a parent, encouraging youth to be involved. So for them, strength training, they said, yeah, actually, because they're developing muscles, actually 3 days a week should be good for them. And again, in an appropriate manner, both for children and adults. I think the one thing is watching that they're doing it appropriately and with good performance. So sometimes that is starting with a lighter weight to make sure that you can actually do the movement pattern appropriately and safely through full range before you start adding on resistance. And with kids, there should be some supervision involved as well, because they still have growth plates that are still forming. And so really watching how they're loading those bones is important to also protect those growth plates. So any supervision they have, I think, is important there. For bone strengthening, thankfully, the good news is a lot of the things they enjoy doing anyways, as we talked about before, jumping rope, just playing tag, those type of things that, get them doing some impact and some movement in different directions is key. So this whole campaign, there's a lot of resources out there, and I just kind of wanted to direct you to that. The Move Your Way campaign has a lot of information and tools and posters and fact sheets, even videos that you could order some of these. I think they even have links where you can print them out. Post them in the break room, or post them in your kitchen, or post them, share them on the websites or in your social media, to encourage each other, and have, be accountable for, we all do better if we have an accountability partner. So whether that's your spouse or a friend, but you as a teacher and educator, hold your students accountable for engaging in exercise as well. So here's the link to get to that area that just gives you information again about different levels and how to maybe campaign each other to improve physical activity and exercise, and just making it a part of a regular routine. So in summary, what I'd like to just kind of say is, as educators, and as parents, I mean, you set, I think, a good opportunity to set the theme for how we can, sort of seize the day to engage physical activity and exercise in our life. I love this picture that I found. This was actually at a school. I mean, anything that we can promote that psychological, sort of benefit, that self-efficacy of both emotional and physical health, just to, again, get that positive affirmation out there about how we, anything that we can do, starting just with a single step: move more, sit less, seize the day, carpe diem. Those are the things that we need to do, because sometimes, again, that first step is the hardest. But I will say that with regular exercise and engagement, maybe, again, encouraging somebody else to exercise alongside you, or to check in on somebody and ask them how they're doing. Share your goals with somebody so they can help keep you accountable. Those are the things that we can do to increase physical activity in our lifestyle, but also get that sort of psychological and emotional boost from the exercise in itself. Before we see the benefit on the scale, we're usually going to feel it. So I encourage you to, again, just get started, because sometimes, in order to feel, again, the weight loss or the strength gain, we've got to stay with it, really to see those benefits. We're talking about 2 to 3 months down the road. You should start seeing some payoff for it. But even to maintain it for a longer period of time is really to see, again, the benefit. So aerobically, we want to get that, again, our goals set up there, but anything we can do to start there, again, strengthening, maybe again, you start with the strengthening goal and then add on an aerobic goal. Hopefully through these activities, you realize the benefit of actually improving, not only for your heart and your muscles and your brain, but also for your bone. And the theme there is intensity does matter. But again, progressively getting there, getting comfortable, getting your muscles and that movement pattern build up, and just sort of feeling good and measuring that response. Hopefully then that will get you to that point where you can actually get up to that intensity of that moderate or vigorous level and feel good afterwards. So here are some of the resources that were used to get the information for this presentation that I think you might even value or benefit from accessing on your own. And at this time, I just kind of thank you for your attention. Hopefully that shed a little bit of new information for you, but I am glad to answer any questions that you might have at this time.
Dr. Camp, I want to thank you for sharing your wealth of knowledge. This was so informational, so great. So I do have a couple of questions from the chat, and I'd like to do an all call at this time. If you, as a participant, do have anything you'd like answered or a comment, put it in the chat and we'll get to that. So the first one I have, and you briefly addressed this, but somebody says, I have not exercised for many, many years. How do I get started?
Yeah. Yeah, and I think that's a great question. That's probably not an uncommon, question and scenario as well. And I think the important thing is to think about where you're at. I often ask my patients, what is one thing that you would like to be able to do better that you're not able to do now? And so if that answer is that, man, I can't even get down on the floor to play with my kids and get back up. To me, that's an issue or concern of, strength, maybe some flexibility, right? And so sometimes, I might want to set some goals there that says, you know what, then here's what I'm going to do. We might measure that leg strength in a functional way. How well can you even get up and down from a chair? Can you do it without pain? Can you do it with control and equal, effort on both legs? And if I might use a squat exercise to build up leg strength just in order to support that, and I might slowly lower the depth of that squat with my clientele. With my older clientele, I often use a chair behind them as a target because that helps to work on proper form, because they don't have the mirrors around them that you might have at a gym to just make sure that your hips and knees stay in good alignment. But we use that chair, and then I keep lowering that seat surface. I might have had to build it up a little bit so they could do it without back pain or knee pain. And then we lower that seat surface until we get to the level of their commode or the level of their car seat or things like that. And then I say, okay, now we're going to grab a couple of dumbbells, but it could be milk jugs, it could be, anything. And we're going to put those in both hands, because now, when's the last time you had to get up from a seated position with maybe groceries or a kid in your arms or, something of that sort? And we add load to that. And so now we're working it from more that strength component. And then, then there might be that work of, now, how do I get up and down from the ground and engage more work through my hips or range of motion that I need in my ankles or my hip joints? And so there may be some work on some flexibility. Along that same line, well, what if your goal is, I just don't want to get as winded? My gosh, I had to walk out to the parking lot the other day, and it was on an incline, and I didn't think I was going to make it. Those, then that might be a more of an aerobic type goal. So what I would say is, it's therein lies again that approach of the Kaizen. Take small steps, decide what your goal is, where do I want to see improvement, and then that might kind of guide where you want to begin. Most of us would say, I want to lose weight, but I don't know where to begin. Well, the good news is they actually found that both resistance strengthening exercise as well as aerobic exercise will raise your metabolic rate. So both of those are going to have benefit on kind of maybe helping with reducing your weight. So you could start with either one of those activities to address that goal. But I think it's better to start with small steps, identify a goal, what's going to help me to get to that goal, and then kind of, come up with a few things that you really worth, trying to apply to that and see how you respond, and then build off of that.
Thank you so much for sharing. As a piggyback question off of that, someone asked, do you recommend seeing a doctor or medical professional before beginning a new program of physical activity?
I think that's a great question and great point. And if you've ever gone to the YMCA or you've gone to a club, oftentimes they're having you sign a disclosure form or, asking you a long list of questions. So that is always a great idea. And especially as an adult, do we have some underlying conditions that we need to make sure are stable to support exercise? So I would say, if you are being treated for any condition, if you have any concern for a condition that you have or have ever been, told that you need to manage a condition, especially with medication or supervision, or even if you're having pain, I think that's one. Your physician is going to give you a lot of clearance, mainly from the standpoint of cardiovascular health, right? And so they might tell you if there's any concern from that standpoint. That's probably the highest risk there. But if you also tell your doctor, but you know what, the reason I haven't been exercising is because every time I do, I increase my pain level in my back or my knees or my hips, then that might warrant your physician to say, well, before you start going to the gym on your own, maybe you need to go see a physical therapist just so that they can help you determine why it is that you're having pain. And that might also help with that. So I think on both points, having a discussion with your physician is good, both one, to have clearance, but that's also a good signal to your physician that you're doing your part to address your health just as much as of what your physician's trying to do for you.
Thanks so much for sharing that. So, to some of the questions in the chat, the first one says, how would you recommend exercise for someone who has exercise triggered asthma?
Yeah, great point. And sometimes that asthma, even though it's exercise induced, may also be irritated by environmental conditions. So that would be another good reason that I would talk to your physician as well. And your physician might even partner with your pharmacist to give you some good education on how you can be using potentially medications or inhalants and that you're properly taking them and timing those to your exercise activity. Because there are some medications that you need to take before in a certain period of time. And then there's others that you can take more as a sort of a rescue kind of inhalant. So I think one of that is proper management, especially if you've ever been recommended to use inhalants for that. The other is, properly warming up. So sometimes, again, that is, not only is that beneficial for joints and for circulation, but it also helps to gradually prepare the lungs for exercise. So proper warm up can also help in managing those symptoms. And you might need to be aware, though, if you also are triggered by the environmental conditions, whether that be sometimes temperature, but also allergens. So you may want to think if it is a temperature related, what do you need to do to wear, we're all wearing face masks right now. And there's a benefit to that of rewarming the air, but it also makes it a little bit challenging as well for air passage. But the other is thinking again about what's the timing of the day that you exercise in relation to maybe when a pollen count is higher.
That's great information. Thank you so much. Another question we have here, and again, this may be more specific to a medical professional of their own. However, someone asked, do you have any suggestions for someone with cervical issues for weight-bearing exercises? Is jumping rope okay?
Yeah, so when you talk cervical, I'm going to just assume that's the neck that they're talking about there. But we talk a lot about impact and compression. And when we talk about jumping rope, a lot of times that's more impact and compression on the lower extremities and even the lower part of the back. But obviously, you have to maintain cervical control. So it would be hard to answer because cervical conditions can come in all different levels of, of intensity or I guess severity. But when we're talking about the neck, it brings up the good point about the importance of posture. So whenever we are exercising, we want to maintain as much of an upright posture. Obviously, if we're running, sometimes we're countered forward a little bit, but how well we maintain our head over our shoulders and over our trunk is really going to dictate sometimes the amount of stress or strain that's on the neck. And so I would say that with regards to jumping rope, that takes a fair amount of coordination, right? It takes a lot about aerobic and how, is your rope long enough and how controlled are you that you're not having to duck your head, right? So the neck flexion that goes on with that. But per se, if you have, a stable condition in your neck and you've got good strength in your neck, there shouldn't be anything that precludes you from jumping rope as long as you're able to maintain good alignment. But I guess a caveat to that would be that it's always important to listen to your body when you exercise. When we're exercising, we expect fatigue, we expect muscle soreness, we don't expect joint pain. And so anytime you are, again, experiencing pain, that might be a good suggestion to get some guidance on maybe either an alternative form of exercise or way to modify that exercise.
Great, thank you. The last comment and question that we have here in the chat says, working in a school, I sit most of the day. How about a walk about the school, upstairs and downstairs each day?
I love it. Yeah, I think if that could be an encouragement, and some of the campaign, the Move campaign are great ones, maybe even to post near an elevator that says, why don't you take the stairs? Things like that to just promote and remind people to be engaged. And yes, I think that the takeaway message is that all of us are sitting more. And I would encourage you to be mindful about taking those breaks. And when you take a break, as active as you can during the allotted time that you have would be valuable. So yes, today I came on the campus and I saw one of my colleagues coming in, and so I knew she was here today. It's been a little bit skeleton crew around here, and so I got to a point where, at lunch, I was texted her and said, "Hey, do you want to go take a quick power walk?" And so for 20, 25 minutes, we just took off and, chatted a little bit as we're doing that walk before I need to come back and see patients. So any advantage, and then I just ate my lunch in a 10-minute time zone. So anytime that you can work in breaks, I think it's great. I know that sometimes we, push through to get to the end of something, but I think the repercussions of that, come back to bite us a bit. And speaking of that, I do think that even postural awareness and how we're holding ourselves when we're sitting for prolonged periods of time can really play into how well you feel. So I would encourage you to kind of be thinking about, we didn't talk a lot about postural attention, but that should be something that you want to think about with prolonged sitting as well.
Well, I just found myself sitting more upright.
I
So thank
know,
you for
just to
that.
say that, don't we all just come a little taller?
Yes.
Yeah.
So we did get one more while you were talking. It's on the other end of the spectrum. So I do want to ask this question. They said, what if you're very active with your students every day, all day? How much exercise should you do for yourself a week?
Yeah, fantastic. No, and that's what I love. I mean, I chose my profession because I knew it would promote activity. I wouldn't have to sit at a desk and I wouldn't have to wear heels. That was a win-win right there. So, again, if you are active with your students, that's already saying that you are doing a lot for your health. You have a job that promotes physical activity, right? So if you feel like, again, now all of us too, after, what's moderate activity for me may be vigorous for somebody else or vice versa. So I guess I would say is what is that goal? Do you feel like you have good health? Is your blood pressure under control? Is your weight under control? Emotionally, do you feel like you've got a good stable mental state? Do you feel like you have the strength to do the things that you want to be able to do? If so, then that means that your lifestyle may already be supporting that. But if you wish that, hey, I was a little stronger because last time I tried to push up out of the pool, I could barely get up out of the pool. Or, aerobically, hey, I've got a trip planned and I want to be able to, summit that mountain and not, be gasping for air and taking my oxygen along with me. If you have, some kind of higher level goal that you want to attain, you might use that as a motivation to say, all right, I want to be able to do that. So what could I do above and beyond what I'm currently doing to achieve that ability to attain that goal?
Thank you so much for answering that. And a sincere thank you to you, Dr. Camp, for lending your expertise to the FWSD Wellness Program this month. We appreciate you. You helped create the content for the kiddos, and you were here, with the wealth of knowledge today. Thank yous are coming in the chat right now. So to all the participants as well, just so you know, to be entered into the drawing this month, it'll be your registration, your participation in this event, and the post survey that will be emailed to you tomorrow morning. So you need to do all three of those. And this will be posted to the YouTube that will live there forever. So this content is here. The resources are here. The URLs are in the presentation that you can go back and grab. So just once again, from all of us, and everybody's coming in the chat now, I want to say thank you so much, and we really appreciate you.
Thank you.
All right, everybody, have a great rest of your day.
Now everybody get moving.
Exactly right. Thanks so
Yeah.
much.